Okay, so it's Peter Passmore, Professor of Aging Geriatric Medicine at Queen's in Belfast. So I've been chairing the session on the managing common and chronic conditions in old people here at the Royal Society of Medicine on the 10th of October. We had a number of talks on different areas pertinent to geriatric medicine. First of all, we heard about atrial fibrillation and anticoagulation in stroke. We heard how important the issue of atrial fibrillation was. That it was not dealt with extremely well, that we needed to do things better in terms of anticoagulating people. The issue around aspirin, which for most people would seem to have been a reasonable fallback position instead of warfarin in people at high risk. I think that was dealt with because we heard that aspirin causes as much bleeds as warfarin in this situation, and the message very much was that where people have atrial fibrillation, if at all possible, they should be on anticoagulants, be that warfarin or some of the novel anticoagulant agents. It was also indicated how, in fact, in many elderly people, the novel anticoagulant agents could actually be of a major benefit. So that was the first talk this morning. We then went on to the issue of urinary incontinence and quality of life from Susie Orme. Again, an excellent talk which dealt with the problems of incontinence in old people, about how this is not often sought for or looked after or routinely asked about, and a number of practical messages given as to how to deal with this at home in the hospital wards, simple signage, the way wards are constructed, use of unisex toilets. We also heard about the kinds of major problems, overactive bladder and also nocturia, and the practical solutions that were available to deal with those, including the medication options. And again, pointing out that some of the preconceived ideas about the medications used for overactive bladder, the antimuscarinic drugs, didn't really make people fall or as confused as much as would have been thought of in the past. There was then a talk from someone from palliative care in Liverpool. Debbie Murphy stood in for Gerard Corcoran, and she gave us an overview of the Liverpool Care of the Dying pathway, and mentioned the recent controversies about that, the recent report that had been performed, and how all of that was going to change, and that hopefully we wouldn't be left in a vacuum in relation to how to deal with end-of-life issues in old people. So again, very useful given the recent publicity. We looked at Parkinson's disease, dementia and Lewy body. These are two diseases that are common in older people. It was the talk concentrated on how they differed and how they were similar and how to distinguish them with the investigations needed, and the need for specialist referral in a number of cases, and the need for specialist neuroimaging. We also talked a little bit about the medical management of these conditions. There were a couple of talks then on metabolic related disorder. So first of all on diabetes and diabetes management. Simon Croxon is an expert there, and he always gives a good overview. So essentially he went through issues around hypoglycemia, the importance of maybe not too tight blood pressure control in a lot of occasions, and emphasised how bad hypoglycemia was in this age group in terms of its risk for dementia, mortality risk, fractures risk, and then went on to discuss the individual agents that could be used for treatment of diabetes. So pointed out many practical facts about the use of new agents such as the gliptins, such as the GLP situation, new insulins, and also help to place the sulfonylureas and metformin in terms of protocols and how we should be using those. The next talk focused on osteoporosis and reviewed all the agents available for treatment of osteoporosis. This again was an excellent overview with many practical messages delivered by Michael Stone from Cardiff. He talked about frail elderly people and how they may just require calcium and vitamin D supplements. He reviewed the whole area of vitamin D. He also went through the bisphosphonates that we use and the advantages of some of the intravenous preparations in particular, new developments there. He spoke at length about denosumab, which is a monoclonal used for treatment of osteoporosis, and again is very feasible to use, and they have a lot of experience with that. And recent issues around teriparatide, and also flagged up the recent concerns about strontium. I then spoke from the practical perspective in terms of hypertension control, so really focusing on optimal usage of the medications that many people are familiar with for treatment of high blood pressure. So really looking at the guidance, looking at what the issues were in terms of not controlling blood pressure and how to use drugs within each class better, hopefully, so that A, these people can be managed in the community, or B, the more appropriate referrals, if necessary, can go into secondary care. I chatted a bit about resistant hypertension, what that meant, how that had to be diagnosed, and also the ability in old people as well to refer for renal denervation therapy in people where resistant hypertension was a genuine issue. And finally, we had a talk from Maggie Kirkup from the southwest area on skin conditions in old people. Excellent overview about the physiology. Skin is the largest organ in the body. We underestimate what it does. The fact that there are major physiological changes that mean skin's compromised, but then the rest of the body physiology can be compromised as well. She went over the dry skin, she went over issues around itching. She covered all the issues around skin cancer, the common squamous cancer in old people, talked about melanoma, and really showed us how the whole spectrum of these diseases had changed, and gave us some very practical information on how to diagnose these appropriately. It's always useful to have a reminder, and also how to treat them in effect. So all in all, a very rounded day, I thought. Some excellent presentations, excellent questions on the way through, and hopefully people have gained quite a lot from their attendance at the meeting.